90% of the treatments fail, not because the medicines or the treatments are not working, but there are many reasons behind it. Just watch this video to know more. So the first reason in this is not getting the right diagnosis. What do I mean by that? First of all, knowing the exact reason for your hair loss is the most important thing. Now, everyone thinks hair loss is only because of baldness, but there are like many reasons for hair loss to happen. Like very common conditions like telogen effluvium or patchy hair loss like alopecia areata. And sometimes it can be very dangerous conditions. By dangerous, I mean that it's a scarring alopecia. In those cases, once the hair is lost, it cannot be regrown. So these conditions should not be neglected. So many people tend to use a single treatment for irrespective of the hair loss condition. So many a times the treatments don't fail, but it is the wrong condition you're using that treatment. That is the reason why the hair loss or the hair fall doesn't get controlled. The second reason is inconsistent use. Now, what is inconsistent use? So basically, we need to understand the timelines of how these medicines are working in that condition. For example, you take a minoxidil. Normally, if you started minoxidil, for the first 2 to 3 weeks, you are going to see a temporary hair shedding, which is absolutely normal, which is the normal physiology that happens. But if you use it for a month and if you tell that minoxidil is just causing my hair to shed even more, then that's a wrong concept. The actual results of minoxidil you get to see only after 2 to 3 months. Then the real results, like in 2 to 3 months, you see decrease in the hair loss, and in the 6 to 8 months, you see increase in the thickness. And the maximum result of minoxidil takes at least 18 months. So by this, you understand that you have to understand the medicine, what you're using, and for what condition. And that's how you get the best results of the treatment. The third is the expectation problem. Now, the results depend on which stage of hair loss you are in. So it's not like you've lost like 60 to 70% of the hair and you expect to get the treatment with by just using medicines. It does not work that way. So depending on the severity, depending on the stage of hair loss you are in, so that's how we need to customize the treatments. If it is the early stage, then medicines will definitely help out. But if it is a late stage, only medicines will not give the kind of results we expect. The fourth reason is no proper internal correction. Hair is a very sensitive organ. It depends on the internal nutritional status, the hormonal status, and many other internal reasons. Just by using medicines, like a DHT blocker for male pattern hair loss, or only a minoxidil or a PRP, doesn't help if the hair is intrinsically not strong. So, how do the hair become intrinsically strong? By giving them a proper nutrition and proper maintaining a normal hormonal status in your body. This will definitely help the medicines to give even better results if the internal situation is controlled. Fifth one, this is the most important, like using cheap products and serums. Now, if you see on the online markets, you get to see so many kinds of thousands and thousands of minoxidils, different serums, rosemary oils, and whatnot. Now, are these serums are approved, and is the minoxidil that they are saying, or the medicine that they are saying, is it there in the product? That is very key. If you just keep on using these serums for indefinite period of time also, you will not see the results for the obvious reasons. Why? Because there is no active ingredient in that. Now, the last and most important part, that is to have a long-term strategy. Hair loss should not be handled in a short-term basis. Yes, in some conditions it can be handled that way, but many of the conditions, like if you are taking a male pattern baldness or a female pattern baldness, we need to have a long-term strategy. Like to start with, how do you control the hair loss? Next, how do you focus on the thickness? How do you increase the overall density of the hair? And after getting all these results, what is the maintenance strategy? When do you want to introduce the regenerative treatments? When do you want to do a hair transplantation? All these have to be strategically planned and strategically executed.